Reyvow is also known as lasmiditan. Reyvow is a prescription medicine for adults. It is used to treat migraine attacks with or without aura when they happen, acute treatment. It is a tablet that you take by mouth. Reyvow is not used to prevent migraine attacks. It is not known if Reyvow is safe and effective in children. Reyvow is a federally controlled substance, CV, because it contains lasmiditan that can be abused. Protect Reyvow from being stolen, and never give it to others because it may harm them. Selling or giving away Reyvow is illegal. Tell your doctor if you have ever abused or been dependent on alcohol, prescription medicines, or street drugs. Do not drive or operate machinery for at least 8 hours after you take Reyvow, even if you feel well enough. You should not take Reyvow if you cannot wait at least 8 hours between taking Reyvow and driving or operating machinery. You should not drink alcohol or take other medicines that make you drowsy while taking Reyvow. The most common side effects of Reyvow include dizziness, sleepiness, numbness, feeling tired, and tingling. These are not all the possible side effects of Reyvow. Tell your doctor if you have any side effects. Tell your doctor about all your medical conditions, including these: liver problems, high blood pressure, a low heart rate, allergy to lasmiditan.
Do not take Reyvow more than one time within a 24-hour period. This means you must wait 24 hours between doses of Reyvow, even if your headache does not go away or goes away and comes back.